While we're getting the slides up, I think we should get everything moving again, because you know that's my modus operandi. So let's get up again and put our hands above our heads and just have a bit of a shake and get the energy moving, get that lymphatic drainage going. And this time I want you to take a deep breath in. And again, hold it in the center of your head, up, up, up. See a bright light. And then I want you to drop this bright light from the center of your head down into your heart. And think of someone you can let your breath go, or something that's really special to you and whom you're grateful for. And just hold that sensation for a few moments. Okay. And now we're back in the room. So just little moments like that throughout your day, super important. I think they're still working on bringing us some slides. I had some quite exciting slides, so we're going to have to make it up if not. Okay. Maybe I can, Leslie has some, didn't they? Okay, so most of you are here this morning, so you know a bit about me and my history, and also Olivia. But we were going to talk through some strategies this afternoon that you can all incorporate into your day. We're also going to talk a little bit about supplements, because even though we love the basics, the foundation, in terms of the pillars of diet, which we're also going to touch upon, I am a fan of strategic use of certain supplements, because I've known how they've affected both my brain, my cognitive performance, my mood, and my sleep. So we're definitely going to come to that. And just as it's hard to do it without my slides, because I'm imagining what's actually on them. But any minute now, we're going to have them up. I just want to have a show of hands in the room. So who takes supplements here of any type? So almost, I'd probably say about 90% of people here take some form of supplement. And when, I think before the pandemic, many people didn't take supplements, and then everyone became fascinated by the use of vitamin D and zinc and vitamin C, and it was killing the virus. So the fact that some of us are taking supplements right now is exciting, but not all supplements are created equal, which we're going to come to as well. So if we just freestyle this a little while the slides come up. When we think about health span, so when we're creating health span is the number of years that you live with health, as opposed to lifespan, which is many of us who have our grandparents, for example, who are aging pretty, not satisfactorily, not aging well, and we become immersed in this concept of decrepitude. So everything we want to do when we think about creating health span is creating a robust, resilient body that can withstand the stresses of life and that can withstand, that can buffer essentially our environment or the pollution in our environment and everything that comes with that. So how are we doing, Lizzie? Okay. So why don't we do it this? Why don't we reverse it? People came up to me at lunchtime and there was lots of questions. So why don't we just field a few questions while we get the slides up?
Shout out if you... Yeah.
Thank you so much. We touched on, thank you, Olivia. We started a conversation about supplements, and you were saying that you like to supplement with specific foods, and that was actually, that was the beginning before we kind of started to.
So I'll say that for everybody, and that is, we have certain food prescriptions. So, for example, oysters are a very rich source of, B12, copper, and zinc. So I will fast to have 3 oysters in a week, or 5 if I'm not feeling very well, rather than reach for a zinc supplement, generally speaking. Liver is another thing that we both agree on, well, me more so than Tam. And, those selenium in Brazil nuts, so I'm very much for food prescriptions first, and then judicious use of quality supplements.
And what about, thank you, that's so helpful, the supplements that are specifically known for longevity, and like I'm thinking specifically of NMN, for example, and I mean the NAD boosters, you know, the things that the likes of David Sinclair are kind of taking at the moment, and quercetin, fucetin, like, I mean, I know you can't bag them all in one, give your view on all of them in one go, but do you have any views on those? Yeah,
so personally, look, we don't prescribe anything, supplements or drugs, that don't have evidence. And I know that people always then tend to think that supplements aren't evidence-based or what, but they are. There is actually a fair amount of evidence now. That it's not as if the evidence is, all randomized controlled trials, and that's the gold standard in medicine. But there is definitely evidence for supplements, and so in our practice we only use the best, I think. And Tam loves her NAD.
We have a slide on supplements, so I will come to that. There are many NAD precursor supplements, of which NMN is one. I don't personally advocate big doses like David Sinclair does, but he has commercial interests in NMN. But we will come to supplements because, like I said, your supplement intake might not be the same as my intake for very different strategic reasons. Let's flick through. I might have to stand up because I can't see. So this morning, I talked to you a little bit about why I'm so passionate about lifestyle and functional medicine, my history with the TBI, and more recently with long COVID, which for many of you in the room who have suffered from COVID and the sequelae of COVID, it can manifest itself in different ways. For me, it was arthritis, autoimmunity, and full-on pneumonitis, which, as I said earlier today, was unusual because I came in the bracket as the fit, healthy individual. But as we will come to talk about as well, the health of our nervous systems, how stressed we are, how well we're sleeping, how good our relationships are, also predict our immune responses to stresses such as COVID. So we just got this an overview. Right, this slide's quite important because these are tools. These are tools that we use in our practice to build health in an individual, and not just for the now, but for the journey of the individual. So I will talk to some of these, and then Liv's going to also talk to some of these. So if we think about nutrition and meal timings, we've touched upon a lot of these, and people do ask me questions all the time. Should I be fasting? Should I be keto? Should I be paleo? Should I be vegan? Should I be XYZ? And I often come back to the point of whatever you do consistently matters the most. I think it's important for people to maintain what we call metabolic flexibility. That is the ability to use different fuels from the diet, for the body to use different fuels obtained from the diet well. So if one, for example, goes on a ketogenic diet, over time one loses the ability to burn carbohydrates very well. So while I advocate ketogenic diets for certain medicinal uses, I think consistent uses of things like the ketogenic diet aren't particularly helpful for the majority. If we also think about fasting, we've talked a bit about fasting here and how that can stimulate what we call autophagy, which is the clearing out of dead stuff in the body. So when we fast, especially overnight when we're resting, we go into this repair state, which we clear out dead debris, our microbiome, our gut microbiome, the ecosystem of bacteria in the gut reset. So fasting can be generally helpful for people, but I'm not talking about long extended fast here, which have their own complications. I'm talking about narrowing the time in which you eat, like the feeding window, as we call it. So that might be eating all your calories within an 8-hour window.
So just with that one, I think that a lot of people have heard of intermittent fasting, which is that narrow window of eating. Yeah. And because some people weren't speaking to a doctor about it or someone who understood it, a lot of women, especially menstruating women, were going onto a 16-8. And because they were fasting too much in a body that required nutrition because you were hopefully preparing for baby, women were losing their periods. So it is really important that even with something that's across social media as everybody should be intermittent fasting, you are speaking to someone.
Yeah, and I think the overarching sort of takeaway from that is if your body feels consistently stressed, and fasting is a stressor beyond a certain period of time, then you will upregulate stress systems within the body, of which one consequence in menstruating females is the shutting down of menstruation. Right, coming to four-cell system hormone optimization, I'm just going to skip through this because this is essentially looking at the hormonal systems which are involved in our day-to-day, but also impact our rate of aging. This is your blood sugar regulation and all the hormones involved with that, of which we heard all about ghrelin earlier in the context of Ozempic. We then have the sex hormones, which is a super important area of which can influence aging, although still remains somewhat controversial in the realm of HRT when we talk about hormone replacement therapy. I do believe that safe and appropriate use of hormones can be hugely beneficial for women as they age in terms of not just providing symptomatic relief, but also improving brain health, bone health, cardiovascular health. We know that estrogen is protective, although we have moved away from using oral preparations of estrogen because of side effects. And then we look at thyroid, blood sugar, sex hormones, and then stress hormones. Stress, as we've mentioned at the bottom, is a hugely important area, which we've talked about endlessly. I like to work with individuals in improving their distress tolerance, as I mentioned earlier, which is basically making you less reactive to stresses in your environment, that you tolerate stress better. And that's often done by incorporating mindfulness, meditation, laughter, joy, and improving sleep quality. And then we talk about evidence-based safe strategic medicines. These are things like metformin, occasionally Ozempic, although with caveats, hormone replacement therapy. There's a big field of interest at the moment in something called rapamycin, which is an immunosuppressant, which also has its downsides. And then exercise, which we've come to, which should involve functional mobility, the ability to actually maintain function as you age. Like this is walking up the stairs without holding onto the banister. It's being able to pick things up on the floor, standing on one leg, that kind of thing. It's building muscle. It's having an anti-catabolic effect with the age, which also has it relates to your protein intake as well, so building that muscle. And then flexibility, as I've said. And there's one other, cardiovascular health, which is doing some intensity of exercise to work on your cardiovascular health. All right, so I'm just going to hand over to you. You can do a mention on sleep and genetics, and then we're going to skip. Oh, sorry. I didn't realize you'd acquired a microphone.
Genetics and epigenetics, I mean, we've talked about this. The fact of the matter is, if you have done a DNA SNP analysis, and many people have, and someone prescribes you medications or supplements on your DNA SNPs, that's genetic astrology. And we really do not encourage that. It has to be in context of your lifestyle, of your history, of your medication, of your diseases, of your parent. It's so complex. I do urge caution with the direct-to-consumer reports. There are plenty that are good, right? But please speak to someone who actually understands DNA SNPs.
These are companies like 23andMe and others like that provide prescriptive analysis. There's one caveat to that in terms of the ApoE gene, which has been shown to be involved with hypercholesterolemia and Alzheimer's risk, which is worth knowing. We're going to skip on because this is quite an interesting slide that shows you what really extends lifespan. And we've covered much of these on a lot of the topics today, but this are the side of things that you want to be on. So more pets, hanging out with women, chatting, gossiping a lot, eating less food overall. That's not stuffing. I think this whole idea of abundance in the diet and then periods of fasting is how we evolved. There's a little bit of dodgy evidence about red meat as it involves TMEO. We won't go back to that, but sitting down, you don't want to do a lot of that. You don't want to sleep too much, but you don't want to sleep too little. Being at the top of your tree in a work sense, so having autonomy in your workplace is protective of your aging as well. And here we go, again, avoiding cancer. Yep, we all want to know how to do that, more of that. Don't be alcoholic, but perhaps get married. Have an abundance of money, which can help you buy a hyperbaric oxygen chamber. Women do tend to live longer, all things considered, probably because we like to gossip a lot. And again, things like exercising more, living at a high altitude, having better muscle mass are all important. So the ultimate recipe, which is somewhat funny: married, happy, go lucky, outdoor loving, sex mad hippie, party girl in senior management with a cat. Okay.
Does anybody here actually hit all those at all? Anybody here that hits all of those?
Almost, Rennie. Yeah, I just, all good. We're not going to talk a bit more about that because we've talked about this. This is talking a bit more about the testing that we do, which is, we'll go into detail with, and again, we've covered this. Determinants of health span, we covered a lot of this as well. Daily activities, sleep, dental health, that's a big one we haven't mentioned. Super important to get your dental health checked. Inflammation, a lot of it starts in the gums. We can get bacteria which leak into the bloodstream that can raise our CRP, our inflammation levels, so that's super important. Yeah, again, having a long-lived mum, that's related to mitochondrial inheritance, the things that generate energy in our cells. Going back to social connectedness, laughing, contemplative practice. So we don't all have to be sitting there listening to calm, meditating. It could be just walking your dog, you know, without a phone. That's contemplative practice, very good for our nervous systems. This is just, again, talking about the same things. We can share these slides so you can have them as reference. Go back to that one. These are some of the things we measure in the clinic with people that can give us an indicator of how well you're aging. Grip strength, a simple device that you can buy on Amazon for £5. You can hold it, you can squeeze it, and that basically tells you if you've got good grip strength. That's as one of the determinants of how well you're aging. CPEX, cardiovascular exercise tolerance test. It's not very pleasant to do. Dr. Jack Kreinler, who's sitting back here, is one of my mentors, does lots of it. But basically, the higher your VO2 max, the more you are capable of extracting oxygen from the blood while you're exercising, the better you age. So being fit is important. And then again, skeletal muscle strength, as I've mentioned. The other one we haven't touched upon, if none of you have had your eyes checked, it's worth having your eyes checked, looking at for ages which are advanced glycation end products, which are basically sticky sugar molecules that stick to the back of the eye. So worth having a look at that. Gonna speed through some of these and then hand over to Liv for a second. Inflammation, you probably all heard about this buzzword of inflammation. Inflammation being the key driver to many systemic processes that end up in us aging. This whole concept of inflammaging is coming about now. And I'll come back to that in the next slide, or ways to modify it. Vitamin D, pretty much all of you probably take vitamin D in some format because it's become one of the substances that we know improves immune health and sort of resilience to this horrible virus, coronavirus. Growth hormone is something we measure in the blood, which I've mentioned the paradox there because you don't want too much of it, but you don't want too little. DHEA is related to adrenals and our stress hormone synthesis, and lower levels of it are correlated with worse aging. But too high, you need a midpoint. And then stress, chronically high cortisol levels, fasting glucose and insulin. And then we do look in more detail about cholesterol and the context of cholesterol, which is much more about just the level. It's looking whether you have metabolic syndrome, inflammation, family history of cardiovascular disease, etc. Telomeres I just skipped on because it's an area of science. Basically, telomeres are little caps that sit at the end of your cells, and as you age, they get shorter. People that have longer telomeres, longer caps on the ends of certain cells, are aging better. Things that improve telomeres or telomere length are things like exercise and all the other things that we've mentioned that are good for our health. Back to inflammation quickly. Do you want to talk to this for a second?
Okay. So, up till about 10 years ago for me in my medical practice, I would absolutely, in the conventional setting, be treating symptoms of diseases. And it seemed as if every year there would be more diseases coming onto the plate. And having a systems approach instead, realizing that what underpins much of the disease that we see in society, whether it's long COVID, depression, type 1, type 2 diabetes, cardiovascular issues, autoimmunity, and allergies, asthma and hay fever as well, is actually inflammation. So if we're able to, first of all, try and figure out why we have excess inflammation, and hint, a lot of it does have to do with stress, then we can modulate it. Now, do we always modulate inflammation through psychological help? No. And that's where the practice or the lens through which I see medicine, which is the psychoneuroimmunology, comes into play. So psychoneuroimmunology is the fact that psychology can affect your nervous system, can affect your immune system, and they're all bidirectional. So there's a reason why that if you are stressed, your immune system doesn't work as well, and you are more likely to get a viral infection, for example. So then we're saying to patients, look, good sleep can actually help with the viral immunity and with your mental health, partly because good sleep is going to affect inflammation. So inflammation can be modulated through a number of different ways, including exercise, supplements, meditation, and so on and so forth. We just have to find the magic formula for you.
And this one's super important because we have touched upon gut health, and people ask me questions about this all the time. And it's become a sexy topic. Everyone wants to look at their poop, see what's in there, what's the microbiome, etc. We know that how you metabolize food may not be the same as I metabolize food. Like the calorie in that donut might not be absorbed by my body the same way as yours because I have different bacteria in my gut. So this is an evolving area of research, which is super interesting. A lot of us walk around with inflammation in our gut because we are stressed, not just because of stress, but we eat ultra-processed food, we drink alcohol, we drink, aspartame-rich foods, and that all disrupts our microbiome. Environmental pollution disrupts our microbiome. So that is an important area, and I encourage you all to look at what Professor Tim Spector's doing with his work with Zoe, which is looking at the correlations between a blood test, a stool test, and a continuous blood sugar monitor. Right. This is just a caveat to say, like, how many of you, when you've got the flu, feel a bit depressed or feel low mood? That's related to the release of inflammatory mediators. We've talked a bit about that. Coming on to a few supplements. This is one of my favorites. I think we've talked earlier about how broccoli can help you live longer. One of the reasons why is because of this active ingredient called sulforaphane, which actually can do a few things, but it essentially can modify some of the genes related to inflammation. So sulforaphane is a super interesting one. It's a xenohelmetic in that it causes a mild amount of stress in our cells, which makes our cells panic a bit and then upregulate their defense systems, so make us more robust. Choline. We haven't really talked about choline yet, but choline is a super important one, especially for vegetarian people. We lack choline if you don't eat eggs, essentially, as well. And perimenopausal women, the demand for choline goes up. So, like today, when I'm coming on stage, when I want a bit more cognitive fluidity, I take something called alpha-GPC, which is the one on the bottom, which can improve acetylcholine function in the brain. It's also been shown to reduce the rate of cognitive decline, so it's worth looking at. And then vitamin D, which we've talked about endlessly. People's absorption of vitamin D from the diet varies massively. Also through the skin, if you've got darker skin, your requirement for vitamin D supplementary may be higher because the melanin in the skin blocks absorption. And if you have any autoimmunity, you want to aim for higher levels of vitamin D in the blood. There's evidence that that can improve relapse rates in autoimmune disease. And this is one of my favorite ones, lion's mane, which has been shown to help brain-derived neurotrophic factor in the brain, which essentially makes our brain connect better. It's more I don't want to use that word, but it essentially, as mushrooms do, they blossom the brain. So lion's mane is a good one to supplement that has emerging evidence in. This is probably worth stating, that food is information, coding information to our genes. We've touched on that quite a bit. Like what we eat genuinely can have a modifiable effect on protein expression. So it's worth thinking about that when we're tucking into our ultra-processed bagels. Some of these supplements here: turmeric, collagen, resveratrol, and ketone bodies. We've got Professor Ketone here, yes. She is how I know her, Kieran Clark. I'm a big fan of ketone esters, of which Kieran's is the best. And we'll come to that. Some of the other core supplements, if food first, right? But nutrient-dense foods, our food isn't as nutrient-dense as it used to be, as Olivia pointed out. Farming, the quality of the soil, et cetera. So I think it's important that we push in a multivitamin, especially if you're pregnant, lactating, breastfeeding. Any demands are extra. I think that a need for a multivitamin, a quality multivitamin, is beneficial. And then we've got magnesium, which many of you have heard that magnesium is a mineral that can support anything from brain health to sleep to muscle relaxation to gut function. So magnesium is a super important one. There's many different types. Curcumin is the active ingredient in turmeric, which is an anti-inflammatory. Resveratrol is not there, but it was in the previous slide as it relates to red wine. It's been shown to also have potentially anti-aging effects. The other ones I'm going to skip over. Nicotinamide riboside is like NMN. It's a precursor to this thing called NAD, which is a universal energy molecule in our cells that declines rapidly as we age with stress, infection, pollution, all of those things. So we want to have more youthful levels of NAD as we age. And taking things like NR, nicotinamide riboside, and NMN on occasion can support this in combination with a healthy diet. The other one is a probiotic, which is potentially been shown to have beneficial effects. We're not going to talk about those. We can talk a little bit about omega-3. You up for talking about omega-3 for a second?
So everybody talks about the importance of good fats. And it's not that omega-6 is bad. It's not bad. It's the ratio that we're intaking in our current diet that may be the problem. So the reason why omega-3 is very important is because it breaks down into EPA and then DHA. EPA very important for heart health, DHA important for brain health. You've heard people talk about the brain as white matter and gray matter. And the reason why white matter is white is because it's fat, it's myelin. As an electrical organ, there's all these electrical impulses, it has to be insulated, and it's insulated by myelin, which is fat. So the quality of the fat that you intake and that's absorbed into your body is going to make a difference to your brain health. Now, on the flip side, you've got omega-6. And omega-6 breaks down into alpha-linoleic acid and then into arachidonic acid and into other pro-inflammatory molecules. Now, I think thromboxane, for example, someone mentioned thromboxane before. The reason why it's important is because if you don't have inflammation in your body wouldn't know where to go to repair. Reactive oxygen species is a signaling molecule. It says to the immune system, hey, come in here, come and fix me here. Which is why when we overdid the antioxidants in the 80s and 90s, you really shouldn't be micromanaging such a very complex system too closely because you can over-antioxidize someone. So that's why omega-3s are very important.
Quality of omega-3s, keeping them cool matters. But they generally, if you eat a lot of fatty fish, you probably don't need to supplement additionally. But there's lots of good evidence for omega-3 in cognitive health. We're going to skip over this. We've only got a few more minutes left. But these are some of the things that we look at, which we've actually covered most of these. So I'm going to skip over that one now. Time-restricted feeding, low carbohydrate versus time-restricted feeding. And then quickly, I can't finish this without talking some of my favorite things, strategies to improve mood, brain health, and all the other goodies that we've talked about. Infrared sauna, or just a normal sauna, provides a heat stress to the body, which has many hormonal benefits, but it also can improve cardiovascular health and brain health. It acts as an exercise mimetic, which means it basically has similar effects on the body that exercise has. So if you can get in a sauna a few days a week, we know that it can, the studies that were done in Finland show that it really can improve longevity outcomes. And then just to finalize, I follow this 80-20 rule. I think joy and a little bit of cognitive flexibility is important, not beating yourself up about the donut or the McDonald's that you had to have that one time, but incorporating more, as all of the things we talked about today, more joy and, happiness in our day-to-day. Thank you.
That was brilliant. I hope you learned at least 20 new things, and if you didn't, we will definitely provide the slides for you. Because there's such a wealth of information on the stage, are there any questions? Okay, let's start here.
Yeah, so
You talked about well-being of women and HRT, which is now a huge phenomenon in the USA particularly. A lot of doctors are practicing the pellet insertion where the hormones are released according to your body weight and all of that. And then you go to the Cleveland Clinic, which they do a lot of research on health in women and all that, and they said absolutely not. It is completely linked to breast cancer. It does protect you from uterine cancer, but it is almost on long term if you do HRT, which is being advocated as, for the well-being of women, women that actually, in the long term, it does cause breast cancer. So what do you, how do you...
I think you have to tread a fine line with HRT. One, you have to look at family history of breast cancer and the type of breast cancer. But, the Cleveland Clinic is obviously right in that unregulated use of pellets that release hormones into the bloodstream made by compounding pharmacies is probably not a good idea. So in my practice, I refer people out to gynecologists, endocrinologists that can look at specific needs for hormones, but I would not use compounding pharmacies, perhaps only for very minor things like testosterone in someone that's proved to be testosterone deficient. I wouldn't go for pellets and injectables that some doctors in the US use of hormones. I think that bioidentical transdermal use, so that's through the skin, use of hormones at low levels in women who are perimenopausal and very close into the menopause. What you don't want is someone to go through the menopause, have many years without hormones, and then shove in HRT 5 years later. That's when we know the risk is super high. So I do think there's a trend, unfortunately, in the US for giving people super high levels of things, which, the US tend to do. I've seen women come on big doses of estrogen, which I would disagree with, but I think small amounts used through the skin of bioidentical hormones can be safely used, and I think the Cleveland Clinic would agree with that.
I think it's important to say as well with regards to hormones that we also have to look upstream. So the chemical backbone of estrogen, progesterone, testosterone is cholesterol. That is the chemical backbone. So quality cholesterol, quality fat is very important. And then downstream, how are you breaking down your hormones? It's broken down in the liver. So if your liver's not happy for whatever reason, or you're not processing your hormones, then that is something that you have to address as well.
That's why we don't use oral estrogens anymore, and that's why the WHI study, which did use oral estrogens, which have to be metabolized by the liver, that's when the risk of breast cancer was higher because of the metabolites.
Another question up here? Yes.
Hi, thank you for the great talk, really informative. One question I've had in my mind for a long time, when you talk about the omegas, do you have any recommendation about the ratio between omega-3 and omega-6 in the diet, or if we are doing supplements?
It's so personalized, really.
Depends on the omega-6 as well.
Yeah.
The type of omega-6 you're having. Obviously, there's different types of omega-6s.
And how it's extracted. So the different companies will extract the omega-6s and 3s in different ways. And of course, whether or not you're having food rich in omegas, so that plays into it as well. You'll need sort of they say more, for example, DHA when you are breastfeeding or when you're pregnant, because it helps with brain growth. And they actually have studies that show that there is a difference in IQ in children 3 years out, depending on how much of the DHA and omega-3s you have in your diet when you're pregnant and breastfeeding.
It's worth saying that you can do a blood test to look at your omega ratio. It's relatively inexpensive now compared to what it used to be. And having tested hundreds of people over the years, everyone who's not supplementing an omega-3 does come up high on the ratio. So, for most people, omega-3 is a relatively inexpensive intervention to supplement with.
The test is called an omega-3 index, or an O3I. There are a few companies that do it, and essentially it's just a pinprick, just a drop of blood, and in the post, and then you get a report back, and we use a lot of it.
Another question?
Thank you very much. That was a really interesting talk. You talked about many exciting interventions that you use, and I just wondered if you have an overarching strategy about how you apply these various interventions in your own life and with clients.
So I have an algorithm, and essentially it's what are the potential benefits. So you can use this for anything, any intervention, any supplement in your life. What are the potential benefits? What are the potential harms? And what are the opportunity costs? Because if the opportunity costs, and this is not just money, but time, or fighting against your oncologist or whatever it is, that is going to give you an idea of where you should go, and then you start to trust your intuition as well. Because all roads lead to Rome. There are so many ways that we can tackle the variety of chronic diseases that we're facing. So I personally use this little algorithm.
I think for me, it's people's bugbears, right? Most people come with similar things. It's like, I'm stressed, I'm overworked, I'm overwhelmed, I'm not sleeping well, I have recurrent minor infections, X, Y, Z. So I think it's teasing apart and looking at people's, I haven't mentioned it as a sort of title, but it's super important because it drives everything else, and my background as a psychiatrist informs this, is emotional health, right? We can take 1,500 supplements and eat the best diets, but if we have unresolved stuff, then it drives a sort of physiological changes in our bodies which are more potent than any effect that eating a microbiome feeding rich diet can have. So I always look at people's emotional health. I do a lot of nervous system work with people. I take people, like I work in between London and Ibiza. When I'm in Ibiza, I take people on walks. I take people on hikes. I breathe with people. I take them swimming. I make them look at nature. I encourage a sense of awe. I encourage connection, because that is more transformational in many people than going on a ketogenic / fasting diet. Of course, you can aggregate these things to have multiple benefits, but I would say working on an individual's emotional health, whatever tools we may use, has been the most impactful in my practice.
And that's why emotional health and psychological health is actually has been shown to be very beneficial for IBS treatments.
This was fantastic. I think that certainly a lot of the women in the audience, and probably most of the men, would love to spend another few hours with both of you, but our time is sadly limited. They will be back up for panel discussion later. But now we have, actually, let's give them a round of applause, because this was fabulous. Thank you very, very much.